Continuous monitoring of colonoscopy performance in the Netherlands. First results of a nationwide registry. Introduction. Colonoscopy is the reference standard for the detection of colorectal diseases. Detection and removal of adenomas during colonoscopy reduces the risk of colorectal cancer, CRC-related mortality. To optimize the quality of colonoscopy, several performance measures have been developed. Of these, cecal intubation rate, CIR, the percentage of colonoscopies with adequate bowel preparation, and adenoma detection rate are clearly defined, the best validated, and the most frequently reported. Unsuccessful cecal intubation results in increased healthcare costs and inconvenience, as the procedure must be rescheduled or an alternative investigation organized. Similarly, the quality of bowel preparation not only influences the accuracy of a colonoscopy, but inadequate bowel preparation is also associated with unsatisfactory patient experience and results in increased healthcare costs. In addition to these parameters, the adverse event rate is regarded as an important performance measure for the minimization of colonoscopy-related risk for patients. All performance measures are usually monitored in a heterogeneous population without distinction between different indications for colonoscopy or in a specific subgroup such as a screening population. To facilitate up-to-date feedback on endoscopy performance, continuous monitoring of performance measures is preferred. In the Netherlands, this is accomplished by two registries, the Dutch Gastrointestinal Endoscopy Audit, DGEA, and the Dutch Registration of Complications in Endoscopy, DRCE. The DGEA focuses on the quality of colonoscopy. Data from all colonoscopies in participating endoscopy services are automatically extracted from standardized endoscopy reports without additional administrative burden. The DRCE is a national web-based adverse event registry for all gastrointestinal endoscopies. This study aimed to assess the feasibility of linking the DGEA and the DRCE. Furthermore, Nass et al. Aimed to describe the quality of colonoscopy within this large Dutch colonoscopy cohort per indication by assessing rates of cecal intubation, adequate bowel preparation, and adverse events. Methods. This retrospective study was conducted with prospectively collected data from the Dutch Gastrointestinal Endoscopy Audit, DGEA, and the Dutch Registration of Complications in Endoscopy, DRCE. Data between January 1, 2016 and January 1, 2019 were analyzed. To calculate adverse event rates, data were linked at the level of endoscopy service. Results. During the 3-year study period, 266,981 colonoscopies were recorded in DGEA. Of all indications, cecal intubation rate was highest in fecal immunochemical test FIT-positive screening colonoscopies, 97%, followed by surveillance, 93%, diagnostic, 91%, and therapeutic colonoscopies, 83%. The highest rate of adequate bowel preparation was observed in FIT-positive screening colonoscopies, 97%. A total of 1,540 colonoscopy-related adverse events occurred, 0.58% of all colonoscopies. Bleeding and perforation rates were highest for therapeutic, 1.56% and 0.51% respectively, and FIT-positive screening, 0.72% and 0.06% respectively, colonoscopies. The colonoscopy-related mortality was 0.006%. Conclusion. This study describes the first results of the Dutch National Colonoscopy Registry, which was successfully linked to data from the National Registry for Adverse Events of Gastrointestinal Endoscopies. In this large dataset, performance varied between indications. The author's results emphasize the importance of defining benchmarks per indication in future guidelines.